Mastering the stethoscope is essential for bridging patient assessment and clinical diagnosis. Cloudtechworld.com describes the process. Mastery requires a systematic approach, ensuring a quiet environment, proper skin contact, and using varying pressure with the bell and diaphragm. Clinicians must meticulously evaluate pulmonary aeration, cardiac rhythms, abdominal bowel sounds, and vascular turbulence to distinguish beginning sounds from pathology. While digital enhancement and AI continue to evolve the field, the core of Auscultation remains a refined human skill. By perfecting these techniques, practitioners can accurately interpret the body's internal signals to identify critical medical conditions. As technology evolves, digital amplification and AI visualization are opening new doors, ensuring that no sound goes unheard. Perfect your technique, trust your ears, and listen closely. The body is speaking. Visit cloudtechbull.com